Hello everyone. Welcome to the URMC God Health talk for today. Our topic is My Feet Hurt. What's that? I don't need a mask for video presentation. Oh good, that's a relief. I have been invited back by Marcia Middleton, which I'd like to thank, who worked with the URMC and Community Health. And we are now going to be bringing the library to you since you guys cannot come to the library. And I hope today's talk offers you a little respite and relief from the 24/7 events that have been going on globally, that have been on television. And I hope we have some fun and learn something today and take some knowledge with us upon our brief presentation today. I'd like to break the presentation into 3 parts. One is going to be problems that we choose. These are things that we actually do to ourselves to make our own feet hurt. Next, we're going to talk about problems that we were born with. These are issues that basically occur due to genetics and the aging process. And at the end of our talk, we will discuss those problems that choose us: accidents, infections, bacterial infections, fungal infections, and things like that. So obviously this is a global problem. You can see displays like this in any pharmacy or drugstore, Walgreens, Rite Aid, CVS. And because it is such a widespread problem, there's a lot of self-medicating available to people. You see displays like this in department stores. I always call this the wall of pain. Generally, these are filled with a lot of footwear that create a lot of problems for people. The most common causes for foot pain is inappropriate footwear, things that are too high, very, very high heels that people wear that cause a lot of low back pain, pain under the metatarsal heads. Another is that they are too flat, they have no support under the arch, they create a lot of medial ankle pain. Things that are too flexible, flip-flops, anything that puts a lot of stress on the anterior leg muscles of the leg. Materials that are too hard plastic, synthetic rubbers that don't supply any cushioning in the bottom of the foot, and then footwear that is excessively worn. This is an example of that old-fashioned flip-flop I was telling you about. Flip-flops were actually developed as shoes to take a shower in a public space or community space or swimming pool or bathing area. These were not made for everyday walking and ambulating. Now people actually wear these things to social events. They wear them to church. Sometimes they even wear them to work. An example of something that's a little way too high is something like this shoe, which has at least a 4.5-inch heel. Something that's way too flat. No arch support whatsoever inside this shoe. It's like a pancake. I always tell people that if something is so flexible that you could put it in your pocket, it's not a good idea to wear this shoe. And of course, none of this footwear belongs to me. These were all borrowed from friends for demonstration purposes. Excuse me. Okay. One of the biggest issues, though, is excessive wear of a pair of shoes. I've actually had people come into my office with footwear that looks like this. I almost want to bribe them. If I bought them a new pair of shoes, would they at least put this pair in the garbage, or can I at least take these and give them something else? People actually get emotional attachments to shoes. They say they feel comfortable, and then they're in there complaining about pain in their knee, pain in their ankle, pain in the bottom of their foot. You should not get an emotional attachment to something that's excessively worn. It's going to be causing more problems than good. I call these the lethal weapon. This is an inch, 4.5 inch heel. I don't see how anybody can wear something like this. You do see people wearing them in the office every day. I think people need to know what is the long-term effects of abusing and wearing high heels on a daily basis. You have a hyperextension of the anterior ankle. You have a lot of pressure on the first metatarsal head, and you have a lot of stress on the Achilles tendon. And doing this repeatedly every day for years over a long period of time can actually cause some irreversible damage and pain on the wearer. These problems just aren't to the female gender. There are issues that men have with wearing shoes that are way too accommodating to the male foot type. The rule of thumb is that the shoe should accommodate the shape of the foot, not the foot should accommodate the shape of the shoe. I don't know anybody who has a pointy foot like this, at least not on this planet. When was the last time your feet were measured? Now, this is a big problem because a lot of people have not had their foot measured since they were children or an adolescent. Your parents took you to the shoe store, you were measured, they were paying a lot of money, you were growing rapidly, and they wanted to make sure those shoes fit. You can still actually get your feet measured in a store with an old-fashioned Brannock device if you so choose to. You just have to ask somebody to do it. I actually keep this in my office to prove to people that their feet are not the size that they think they are. If you go and ask someone to do this in a department store or an athletic foot store, they're very happy to do it for you. If you have one foot that's a little larger than the other, which most people do, of course you buy the shoes that accommodate the larger foot. You should have at least 1/4 inch between the big toe and where the shoe ends. If you have a second toe that's longer than the big toe, then of course we're going to measure your shoe size from the second toe. This I call foot armor. This is actually a patient of mine, and I took a picture of her, and when she comes in, she has a pad on her 5th toe, she has a pad on her first toe, she has a bunion shield, and she has a pad on the heel where she's having pain as well. And she wonders why her feet hurt. She wants to wear a certain type of shoe, and I can't convince her for some reason, why don't you just wear something that fits you properly as opposed to trying to make your foot fit into a shoe that is just not made for your foot type. I actually have a couple pairs of those, again, borrowed from friends. This has never even been worn. I've never even gotten out the house. Oops. No, this doesn't belong to me. Again, there's a picture of that old-fashioned Brannock device. Oh, I licked my finger. Don't tell anybody. Okay, we're going to see some examples of some common sense shoes. Here, a nice 2-inch heel that's stacked. A wedge takes stress off the heel, takes stress off the metatarsal head. Here is a sandal with a nice arch. And here's some examples of some good athletic footwear. Anytime somebody tells me, well, when I'm exercising, my feet hurt, I always say, well, can I see the footwear that you're using? If you are using something that looks like this is not athletic footwear. Athletic footwear should have a lot of cushioning in the heel. It should have a nice wide toe box. It should have a built-in insole. And when you're using your athletic footwear, you should wear some nice moisture-wicking cotton or cotton polyester athletic socks. Some people actually go walking in nylon knee highs, which is creates a lot of heat, a lot of friction, and creates a lot of moisture. So again, we're talking about the proper footwear, inappropriate footwear for the purpose that is being used for. Next, we're going to talk about those problems that choose us. Again, these are conditions that you were probably destined to get anyway. This is a bunion, and here we have hammertoes. Bunions are a bony prominence of the first or fifth metatarsal head. They can be flexible, they can be rigid, they can be painful, they can be non-painful. Sometimes we can do conservative treatment with accommodation of the proper footwear or orthotics. Here we have an example of hammertoes. Hammertoes are contractures of the lesser proximal or distal interphalangeal joints of the foot. Again, these may be flexible or rigid. They can be painful or non-painful, and again, may be treated either conservatively with accommodated footwear. If these are painful off-wear bearing or outside of footwear, then perhaps surgical intervention would be better. Another common foot problem is arch pain. This can be a result of two opposite opposing deformities. One is a very, very flat foot, which we call pes planus. The other is a very high arched foot, which we call pes cavus. Both these problems can be accommodated by either wearing an orthotic or an insole. This can be something that is bought over the counter or perhaps need be made custom for the patient. Another very common complaint about aching feet is heel pain, also known as plantar fasciitis. This is because this is the plantar fascia. This is the anatomical name of the tendon where the pain is being produced. This is a tendon that runs along the bottom of the foot. It starts in the heel bone or the calcaneus, runs under the arch of the foot, and fans out on the metatarsal heads. This can be caused by a combination of things, excessive walking, excessive standing. Sometimes if a person has an occupation where there's a lot of walking back and forth all day long, this can be also caused if you're very athletic or you're doing a lot of jogging or exercising and you're coming down on the bottom of the foot with a lot of pressure. Another cause is obesity. The cross-section of the bottom of the foot is made to accommodate a certain size or a certain weight. And once that person starts putting too much weight on the bottom of the foot, there's a lot of excessive pressure on this tendon. It becomes inflamed. Again, this can be supported or helped to improve the condition by use of an orthotic. Patients can also take NSAIDs like Tylenol or ibuprofen, stretching, ice. If the person is not getting better, we can do something a little more invasive like steroid injections. Person can wear a splint at night, or sometimes they have to see a physical therapist. Another problem is trauma, things that we can avoid, or some accidents can be avoided. These are strains, sprains, fractures, foreign bodies inside the foot, obesity, repetitive motion from an occupation. We see a lot of these now with people walking around looking at cell phones, not watching where they're going. Sometimes these need to have an x-ray, and person may need to be casted. There usually is a presentation of a lot of pain and a lot of swelling and discoloration of the foot. Next, we're going to talk about metabolic disorders. Metabolic disorders are those conditions that are inside the body themselves that affect the health of the person overall and can also have a side effect in affecting the feet of the person. The biggest one is diabetes. High blood sugars can cause numbness or tingling and burning of the feet. Often if the blood sugars get above 200 on a daily basis, patients will complain about this. One way of managing this problem is controlling the blood sugar. If that's not enough, the person may have to take medication. Arthritis is caused by stiff joints. This may be caused by just due to the aging process or trauma. A person who fractures or breaks a bone in the foot and it does not heal properly, or even once it does heal properly, later on or constantly after that, they're going to have some kind of achiness or pain in the area. Gout is an inflammatory arthritis due to high uric acid levels in the blood. This usually is proven by taking a simple blood test. This is a condition that most people say comes on very abruptly. It does not have to be preceded by trauma. This is a condition that has to be treated with medications and change in the patient's diet. Poor circulation is decreased blood flow to the feet. With this, we usually see a lot of swelling in the person's foot, a discoloration of the skin. The feet may be excessively cold to touch, and it may be a side effect of the person being diabetic. There may be a blockage in the flow of the blood to the feet, and is also made worse by cigarette smoking. One common skin condition I see very frequently is warts. Warts are a viral condition where the virus actually infects the person's skin on the bottom of their foot. It burrows into a blood supply and then it multiplies and grows. These are usually very painful. They can often occur in areas of the foot where they're not particularly a pressure point, and they actually bleed very easily. These usually have to be treated with medication. Either they need to be frozen, chemical ablation where a chemical is applied and removed later to help remove the wart, and sometimes it actually requires surgical excision. A big thing to prevent warts is to not walk barefoot. Very important. That's a very big issue with me, a pet peeve. Increasing the hygiene, keeping the feet protected, keeps you from catching a lot of these things. Calluses is a protective growth of skin. Now, we usually do see this on pressure points. Again, this has to do with the shape of the foot and gravity. This can also be made worse by barefoot walking and obesity. These are a little more difficult to correct. Usually they need to be debrided in the office. Person may benefit from wearing orthotics and, of course, increasing their level of hygiene, keeping the skin moisturized. Corns happen on the tops of the toes. Calluses happen on the bottom of the foot. Corns can usually be accommodated because they are usually caused by friction of a shoe. So if we remove the friction of the shoe over the foot deformity, or not even a foot deformity, you can have a corn over a very perfectly nice foot. If it's all caused by footwear, we could just relieve that by wearing the proper footwear. Hammer toes can be made to feel worse if we're wearing those tight pointy shoes that I showed you earlier. Heel fissures are usually caused by deep cracks in the skin. The skin is so dry it becomes desiccated. It just gets so dry it just cracks right open. We see these in people who wear backless shoes, slingback, sandals. We also see this in people who chronically walk barefoot or people who are very obese. There's a simple solution sometimes that is very helpful. It's just moisturizing the skin. Skin should be moisturized once every 24 hours. The water inside of your skin evaporates into the atmosphere and needs to be replenished somehow. And these are things I just found around my house. And if I probably took the time, I could find 30 more bottles. And people often ask me, well, what's the best foot cream to use, Dr. Adams? And I say, look, whatever you have, because it's certainly not going to jump out the bottle onto your foot. You could probably use anything you have in your home as long as you're using it at least 24 hours. I call this too much of a good thing because there's things that we do catch when we are just out in the environment walking around. So fungal infections are usually caught in areas where community pools or showers or saunas, hot tubs, the club, the gym. Again, when people are doing certain chores out in the yard and they're choosing to do them barefoot, gardening and yard work, maybe just sitting outside around playing with the kids, you really should be protecting your foot. This is the time, if you're going to catch something, you can prevent yourself from getting in trouble here. Fungal infections of the skin. One way you can catch is by barefoot walking. There's a lot of moisture between the toes or moisture inside the socks and shoes. Some people have a habit of liking to wear the socks to bed overnight while their feet are sweating. This creates a nice breeding ground for fungus. It presents as a scaling rash that often itches. Sometimes it does present with an odor. You can use powders or topical creams. Sometimes you have to take oral medication. Again, you have to practice some good proper hygiene and avoid catching these things. Again, no walking barefoot. Onychomycosis, I see this a lot. This is actually a fungal infection of the toenails. This is an infection that actually lives underneath the nail bed and usually can be caught by using infected grooming implements. It can be caught in pedicure parlors. It could be caused by trauma. We see it in some of the metabolic diseases like diabetes or people who have poor circulation or in the older population. Some people we're actually finding are just genetically predisposed. And this has a very poor outcome using topicals. This basically always has to be treated with pills, especially if the condition is very extensive, such as we see here. A bacterial infection from an ingrown toenail usually will require antibiotics and excision of a portion of the nail. This can be done by removing this portion of the nail and is caused usually by improper trimming of the toenail. Some people like to trim the cuticle of the nail and they introduce bacteria underneath the nail bed. It can also be caused by improperly fitting footwear. If the footwear is too tight or too short and it's resting on that part of the nail and forcing it to go down into the nail bed. So we're just going to go over some things that we talked about today. My biggest thing that I think will help a lot of people is wearing properly fitted shoe gear. This will keep us out of a lot of trouble. And we want to make sure that if we do have any foot deformity, that the shoe gear accommodates that deformity. Managing our other health problems, if you're diabetic, keeping your blood sugar under control, issues with gout and other metabolic disorders, making sure we're taking our medications, following a healthy diet, protect feet from trauma, avoid walking barefoot, avoid putting ourselves in situations where we're at risk by falling. The other thing is practicing good hygiene, making sure our feet are clean, making sure that they're covered, making sure they're dry properly and moisturized. And if we do have pain or we do have an infection or we do have an ongoing problem that doesn't seem to be resolving, we need to seek medical attention. And please, people, wash your hands. This is going to help all of us globally going forward. This is the new normal, which has actually always been the old normal. A little soap and water and a little bit of care. And I hope you all learned something today. I also enjoyed this respite myself, and I'm very happy to have this to you and give myself a little break. This was nice. Take care. Bye-bye.